The benefits of hiring a blood cleanup company in Tampa. Whether it's for a crime scene, an accident, or a disaster, you may need the services of a blood cleanup company. If you are cleaning up blood, it's essential to know what to do, and how long it takes to complete the job. It's also important to know how much the blood cleaning company will cost you. Who do you call to clean biohazardous blood? Whether you are cleaning up a traumatic event or just a random blood spill, it is important to clean the scene thoroughly. A professional blood cleanup service should be hired to perform the job properly. Blood is a biohazard, which means that it may contain bacteria or infectious diseases. Bloodborne pathogens can be transmitted through cuts or bites. You could also be exposed to hepatitis B or hepatitis C, or you could become infected with a human immunodeficiency virus. A good biohazard cleanup should include using personal protective equipment, such as a safety mask, gloves, and a water-resistant gown. A good cleanup will also include using the appropriate disinfectant. There are many companies that offer this service. One of them is Advanced Biotreatment. They have been in business for almost 30 years. They offer 24/7 service and are well equipped to handle the job. There are several biohazards to choose from, but blood is by far the most common. Blood is messy and can be difficult to remove, so it is best to leave this cleanup to professionals. The proper cleanup of a blood spill is an important step to protecting yourself from the potentially harmful disease. Getting the job done correctly will not only keep you healthy, but it will prevent further accidents from occurring. How much do blood cleanup companies cost? Getting rid of bodily fluids at a crime scene is no walk in the park, and the monetary reward is not to be trifled with. The cost to clean the tarnished relics of yore can range from a few $100 to a couple of grand. For those who can't afford to pony up the cash, the Federal Crime Victim Reparations Agency, CVRA, provides financial assistance. The most important thing to remember is that blood and other bodily fluids should be disposed of in an approved facility. The best way to go about this is to use a professional hygienist. The most common problems include stains and blood clots, which should be remedied as soon as possible. If you are looking to have your bloody abode inspected by professionals, be sure to check the credentials of anyone you hire. Keeping blood in a proper disposal vessel is a job for the professionals. The best thing to do is to contact a reputable blood cleanup company and have them handle the dirty work. The best part of the whole process is that they will be able to answer any questions that you may have, and you won't have to deal with the kinks. How long does a blood cleanup take? Whether you are a medical professional or a member of the general public, you should know the steps to take when cleaning up a blood spill. Taking proper precautions will prevent the spread of harmful pathogens. First, make sure that you have the proper personal protective equipment. You should wear gloves and boots while cleaning up the blood. You should also use a disinfectant and disinfectant wipes. Afterwards, place the materials you have cleaned into a biohazard bag. The bag should be sealed with a biohazard warning label. You should also place a second bag inside of the first. Next, wipe the affected areas with a paper towel. Then, apply a hospital-grade disinfectant solution. The disinfectant will kill the virus. It is important to rinse the disinfectant thoroughly with water. After this, you should wash your hands with a disinfectant soap. You should also dispose of the damp towel in a biohazard bag. Finally, clean the area 3 times. This will help eliminate any leftover disinfectant solution. You should also double-check the area to make sure it is free of blood. Depending on the amount of blood you have to clean up, you may need a different set of personal protection equipment. You may want to wear a disposable gown or disposable gloves. These items will absorb most of the blood. Do you need to be trained to clean up blood? Fortunately, the healthcare industry does not require a specific certification to clean up a blood spill. But, there are a few tips to keep in mind when dealing with this potentially infectious liquid. First, make sure you're using the proper equipment. This includes the right mask for the job. You also may need disposable gowns or gloves. Secondly, it's worth remembering that blood is a source of many diseases, including HIV, hepatitis B and C. It's important to use proper disinfection procedures to avoid further spread of these infections. The Bloodborne Pathogen Standard, developed by OSHA, includes several safety measures aimed at protecting workers from the hazards of blood. These include a 10-step protocol for cleaning up a blood spill and the use of a bleach solution that is strong enough to kill pathogens. Finally, don't forget the old standby: wash your hands. Especially after handling any type of blood, you must thoroughly disinfect your hands, and dispose of any items that may have come into contact with blood. Luckily, there are specialized services that handle biohazards and medical waste. These experts have the training and experience to get the job done safely. To ensure your employees' safety, be sure to provide them with the right training and equipment. They also have the right to refuse tasks that are outside of their job description. Do cops clean up blood at a crime scene? Keeping a crime scene clean is no small feat. After all, it may contain human remains, body fluids, and other nasties. These hazards need to be handled with care and vigilance. While cleaning a crime scene may be a daunting task, there are professionals who have the skills to take the weight off your shoulders. Aside from the obvious task of disposing of any furniture, fixtures, and loose-fitting clothing that were contaminated during the crime, there is an array of health and safety measures that need to be implemented. The best part is that they can be enlisted to carry out their duties at a moment's notice. The main problem with cleaning up a crime scene is the health and safety risks involved. For example, body fluids and blood can exacerbate disease or bacterial infections and can spread to the surrounding area if not properly cleaned. These dangers should be considered when deciding which is the best company to hire for your needs. While cleaning up a crime scene is no easy feat, the most important task is securing the area and ensuring the safety of all who are present. The right people on the right task at the right time will be rewarded with the best possible outcome. Is blood a biohazard? Unless blood is contaminated with infectious diseases, it is not a biohazard. However, it can be harmful if it comes in contact with other objects. So, it is best to avoid handling blood. It is a good idea to hire a professional to clean up blood spills. Usually, blood spills occur in medical facilities, but they can also happen in schools and homes. In case of a major spill, you should have a lot of decontamination equipment and more people on hand. Blood contains pathogens that can cause serious illness. Some examples of diseases that can be transmitted through blood are hepatitis, AIDS, West Nile virus, and parasites. Aside from these diseases, it is possible for you to get sick if you come in contact with bacteria and other microorganisms. Aside from these diseases, it is also possible for blood to be contaminated with chemicals that can be harmful to the environment. Hence, it is best to dispose of blood as medical waste. If you need to remove blood from your floor or a surface, you can use a bleach and water solution. You should allow the disinfectant to stand for 15 minutes before scrubbing it off. Is handling blood when cleaning dangerous? Taking on the task of cleaning blood can be a stressful and overwhelming experience. It is necessary to follow proper procedures, wear the correct PPE, and dispose of the biohazard safely. Blood is a biohazard, and is often contaminated with infectious microorganisms, hazardous agents, and viruses. If you handle it improperly, you can be exposed to bloodborne pathogens, which can lead to illness. These pathogens include HIV, hepatitis B, and hepatitis C. It is important to use disinfectants and sanitizing agents when cleaning up blood. A commercial-grade disinfectant should be diluted with water and allowed to soak through absorbent towels before wiping up the spill. The solution should settle for 10 minutes before it is rinsed off. In addition to disinfectants and sanitizing agents, you will need to wear the appropriate personal protective equipment, PPE. Different situations will require different forms of PPE. Typical forms of PPE include disposable gloves, masks, and gowns. For larger blood spills, you should place the material in a sealed container. The container should be labeled. It should also be disposed of in a designated infectious waste area. If you aren't sure how to properly dispose of biohazardous material, contact a professional cleanup service.